Hello, this is a video where I will be demonstrating a manual small incision cataract surgery in a hypermature cataract, almost a Morgagnian cataract. So after the peritomy and the wet cautery has been done, I just dry the surface to place in my frown incision with a 15 number Bard Parker knife. And you can see my only point of fixation is with the limbs on the tenons. There is no bridal suture in place. And once that has been done, I go ahead with my crescent blade and start dissecting out my sclerocorneal tunnel. And since I have only a single point of fixation, you have to keep changing that point to get a better hold in order to assist you in the dissection of this tunnel. And although initially this sort of method will be a little tough, with practice it becomes pretty easy. And then I just go ahead, put in my side port, enter the anterior chamber with my keratome and stain the capsule through the side port under an air bubble and express both with 2% HPMC. And this is almost real time, most of it is unedited. So, and then I go ahead with my bent 26 gauge needle and fashion my capsular excess. Now since there is a lot of egress of fluid, this is what I usually do. I just wash out the excess fluid. I'm not going to wash it off entirely and tamponade the rest with 2% HPMC. Just watch this. Whatever is the excess fluid, it comes out of the anterior chamber. The rest is tamponaded. I don't try to aspirate everything from the capsular bag. So, but you have to do this rhexis a bit fast, otherwise the fluid will egress. Sometimes it is difficult to control these capsules, and just turn the flap over so that I have a better grip. And as long as the HPMC doesn't escape, the fluid cortex pretty much stays within the bag and not giving me any trouble to visualize and complete my rhexis. There it is completed. And once that is done, I go ahead and open up my incision. Watch these movements, all forward movements, no backward movements when I open up the incision. I don't need to do any hydrodissection. I just put in some HPMC, take both my, and there you can see how much fluid cortex is there actually. Take both my Sinskey hooks. You can't dial this out. This is the pickup technique. I hold it between, like, like chopsticks almost. Hold it and bring it out. The nucleus, I mean. Once that's out, most of it is fluid cortex. There will be some fibers. You have to wash that off, of course. But most of the cortex is just fluid. The rest you may have to spend a little time. You can also use your side port, and there you can see there are some bits and pieces of cortex which you will have to remove. Just going around and trying to do as much as a cleanup as possible. Don't be very aggressive with these bags. These bags can be pretty loose. They may suddenly just come off with your simple cannula. So if there is some few fibers of cortex, I wouldn't be very worried about it. Just leave it. I then put in some HPMC. Now is the time to implant my single piece PMMA 6mm lens. directly it goes into the bag. I then flex the trailing haptic and twist my wrist a bit and let go of the trailing haptic into the bag itself. So there's no time wasted in dialing and stuff, and it's very difficult to dial in such bags. And once that's done, I take off all the HPMC. Hopefully a bit of free cortex also comes as well. I then put in my intracameral antibiotic, hydrate my parasynthesis, and I will conclude by giving a subconjunctival injection in the cut area of the peritomy. I just pull the flap down, and there you can see, give the subconjunctival. This is to push this conjunctiva and so that it covers the incision very well. You don't need to suture, you don't need to cauterize. Thank you very much for watching.